there are so many people out there that when it comes to obesity have trouble talking with one another. Doctors, of course, it's our job to inform patients about their health, but could talking to them about their weight ever be considered fat shaming? So patients have taken to Twitter with the hashtag #DiagnosisFat, expressing some of their own frustrations. And one in particular says, told the doctor my dad was dying of cancer and I was depressed, so busy harping on my weight, she forgot that I was depressed, hashtag #DiagnosisFat. Had a migraine, went to the doc, got a whole spiel about my weight, hashtag #DiagnosisFat. My knees were in so much pain and doctor said it was due to my weight. Turns out have arthritis, hashtag #DiagnosisFat. Well, one doctor is now stirring up a controversy because a recent article was written saying that when it comes to her patient's weight, she is butting out of the conversation. That doctor joins us now via Skype, Dr. Elizabeth Berman. Thank you so much for joining us. We talked often on the show about how difficult conversations can be and how fat shaming has become so predominant in our society and such a negative. But what about the stance? You're saying, you know what, I'm just not going to even discuss this anymore with my patients.
I'm not saying that I will not discuss weight with my patients. What I will not do is just walk into the room and tell them that they need to lose weight. We know that those conversations don't help people lose weight, that they are fat shaming, and that they can make people feel guilty and frustrated, and they're counterproductive. So
now how do you address this important topic with patients? Because a lot of doctors, I've said this many times, when you go through medical school and you go through your training, you may learn about medicine, but you don't always learn about the human interaction in the way that it can be best achieved. How do you go about it in your own practice?
Well, like everything else, I think you have to approach this topic with humility, meaning that you don't know all of the circumstances of the patient and what's caused them to be overweight or to need to make some healthier changes. And then compassion. So listening to them and meeting them where they're at. And finally, evidence. So time and again, studies have shown that simply telling people to lose weight, even if you have an hour to counsel them, that is not going to help them lose weight. What they need are long-term, intensive lifestyle support change programs. And we have to think about our counseling like anything else that we're evaluating in terms of its effectiveness.
Well, Dr. Berman, thank you so much for joining us. We appreciate it. And certainly, I think it highlights, there is actually some good evidence out there that doctors who partner with their patients, those patients do better. And sadly, not enough action plans are put into place where the patient does feel like a part of the process. And I think obesity is probably the easiest example because in a 5-minute or 10-minute office consult, realistically, you're not going to have the time to create an action plan where there can be a successful...
Handing them a sheet with a diet and exercise, try this, that's going to fail every time.
So the way we do it in our clinic is we have the doctor talk about the need to lose weight, and then we have a health coach drawn from the community, speaks the language of the patient, doesn't speak Latin, explaining how do you accomplish this? What are little things we can do? I'm going to text you, I'm going to Skype you, I'm going to keep you on point.
Z-Dog, that is dope.
Awesome.
West Side? Or East Side, it's cool.